On the morning of February 23, 1945, Canadian nursing officer Victoria Hayes arrived at the makeshift medical station established 3 kilometers southeast of Manila's city center. The facility, hastily constructed from salvaged materials and canvas tarpaulins, served as a primary treatment center for civilians displaced by the ongoing liberation operations. Hayes, 26 years old and assigned to the Royal Canadian Army Medical Corps, had been stationed in the Philippines for 11 weeks. Her unit's official mandate involved treating wounded Allied personnel, but field conditions had expanded their responsibilities to include civilian casualties. The medical station occupied a former elementary school building on Rizal Street, its concrete walls bearing the scars of artillery strikes from the previous month. Canadian engineers had reinforced the structure with sandbags and wooden supports, creating a functional medical facility despite the ongoing proximity to active combat zones. Hayes documented in her field notes that the station typically processed between 40 and 60 patients daily, most suffering from malnutrition, infected wounds, and diseases associated with poor sanitary conditions. At 0700 hours, Hayes reported to Lieutenant Colonel James Morrison, the facility's commanding officer. Morrison, a career military physician from Halifax, had established protocols for civilian treatment that often conflicted with official military directives. The morning briefing included updates on supply shortages, staffing rotations, and intelligence reports regarding Japanese military movements in the surrounding area. Morrison noted that advancing Canadian units had encountered increasing numbers of displaced Japanese civilians, many in critical medical condition. The morning routine proceeded according to established protocols. Hayes and 3 other nursing personnel conducted inventory checks on medical supplies, prepared surgical instruments, and reviewed patient files from the previous day. The facility operated with limited resources, relying primarily on captured Japanese medical equipment and supplies requisitioned from liberated hospitals in Manila. Hayes recorded that morphine supplies remained critically low, with only 12 vials remaining for emergency procedures. At approximately 0830 hours, Corporal David Chen, a Canadian radio operator assigned to the medical station, received an urgent communication from advanced reconnaissance units operating northeast of their position. The transmission, partially obscured by static interference, reported the discovery of a large group of Japanese civilians requiring immediate medical assistance. Chen transcribed the message: "Multiple casualties, severe malnutrition, requires immediate evacuation to medical facility." The exact number of individuals remained unclear due to communication difficulties. Hayes prepared the medical station for a potential influx of patients. Standard procedure required the establishment of triage areas, sterilization of additional surgical instruments, and coordination with transportation units for patient evacuation to larger facilities when necessary. The nursing staff cleared 3 additional treatment areas within the main building and prepared makeshift bedding using canvas stretchers and salvaged blankets from nearby destroyed buildings. Lieutenant Colonel Morrison consulted with military intelligence personnel regarding the legal and operational implications of treating Japanese civilians. Official military directives emphasized the priority of Allied personnel in medical treatment allocation, but field commanders possessed discretionary authority in humanitarian situations. Morrison determined that the medical station would provide emergency treatment while maintaining protocols for potential security threats. The first transport vehicle arrived at the medical station at 0915 hours. A Canadian Army truck, modified with bench seating and canvas covering, contained 11 Japanese women ranging in estimated age from 22 to 47 years. Hayes noted in her preliminary examination that all patients exhibited signs of severe dehydration, malnutrition, and exhaustion. Several patients had infected wounds on their feet and legs, consistent with prolonged walking over rough terrain. Hayes began her initial medical assessments using a combination of basic English phrases and gesture-based communication. The patients appeared cooperative, but exhibited signs of extreme fatigue and disorientation. Medical examinations revealed that 8 of the 11 patients required immediate intravenous fluid replacement, while 3 patients showed symptoms potentially consistent with early-stage dysentery or similar gastrointestinal conditions. The most critical patient, identified in Hayes's notes as patient 7, had collapsed during transport and remained unconscious upon arrival at the medical station. Hayes documented elevated body temperature, rapid pulse rate, and signs of severe dehydration. Patient 7 appeared to be approximately 35 years old, wearing civilian clothing that suggested middle-class background. Her identification documents, recovered by the transportation unit, indicated residence in Manila prior to the current military operations. Hayes administered emergency medical treatment following established protocols for dehydration and heat exhaustion. The medical station's limited supplies necessitated careful rationing of intravenous fluids and medications. Hayes prioritized patients based on severity of symptoms rather than military affiliation, a decision that aligned with Morrison's humanitarian directives, but potentially conflicted with official military priorities. During the initial treatment period, Hayes attempted to gather basic medical history information from the conscious patients. Communication remained severely limited due to language barriers, but several patients provided fragmentary information through gestures and basic English vocabulary. Hayes learned that the group had been traveling on foot for approximately 2 weeks, seeking medical assistance for family members in areas controlled by Allied forces. The second transport arrived at 1100 hours, containing an additional 7 Japanese women and 2 elderly men. Hayes noted that this group exhibited similar symptoms of malnutrition and exhaustion, but several patients also showed signs of respiratory infections and potential tuberculosis exposure. The medical station's capacity approached maximum limits, with 18 patients requiring simultaneous treatment and limited nursing personnel available. Hayes coordinated with Corporal Chen to request additional medical supplies and nursing personnel from larger medical facilities in the Manila area. The radio communication process proved challenging due to ongoing military operations and the lower priority assigned to civilian medical requests. Chen's transmission logs indicated that supply requests required approval from multiple command levels before authorization. Patient 7's condition deteriorated during the late morning hours. Hayes noted decreasing responsiveness, irregular breathing patterns, and signs of potential organ failure related to prolonged malnutrition and dehydration. The medical station's limited diagnostic equipment prevented comprehensive medical evaluation, requiring Hayes to rely on clinical observation and basic vital sign monitoring. Lieutenant Colonel Morrison consulted with military command regarding evacuation procedures for critical patients. Standard protocols required approval from intelligence personnel before transporting Japanese civilians to larger medical facilities with access to Allied military personnel and sensitive information. The approval process typically required several hours, during which patient 7's condition continued to decline. Hayes documented her growing concern regarding the ethical implications of delayed treatment due to security protocols. Her nursing training emphasized immediate medical intervention regardless of patient background, while military directives prioritized operational security and resource allocation for Allied personnel. The conflict between medical ethics and military regulations created significant stress for healthcare personnel operating in combat zones. The medical station received authorization for patient evacuation at 14:30 hours, Hayes prepared patient 7 and 3 other critical patients for transport to the larger medical facility at Fort Slocum, approximately 12 kilometers southeast of Manila. The evacuation required coordination with military police for security escort and transportation personnel for specialized medical vehicles. During the evacuation preparation, Hayes discovered a small notebook among patient 7's personal belongings. The notebook contained handwritten entries in Japanese script, interspersed with occasional English words and phrases. Hayes recognized medical terminology among the English entries, suggesting that patient 7 might possess medical training or knowledge relevant to her current condition. Hayes consulted with Japanese-American interpreters attached to intelligence units regarding the notebook's contents. Translation resources remained extremely limited due to operational priorities and security restrictions on Japanese language materials. Initial reviews suggested that the notebook contained medical observations and treatment notes, but comprehensive translation required specialized personnel not immediately available. Patient 7 regained consciousness briefly during transport preparation. Hayes documented that the patient appeared to recognize her medical surroundings and attempted to communicate through gestures and fragmented English phrases. Patient 7 indicated pain in her abdominal area and pointed to other patients in the group, suggesting concern for their medical condition rather than her own immediate needs. The evacuation convoy departed the medical station at 1500 hours. Hayes accompanied the patients to provide continuous medical monitoring during transport. The journey to Fort Slocum required approximately 45 minutes over damaged roads and through areas with ongoing military activity. Hayes maintained intravenous fluid administration and monitored vital signs throughout the transport period. Upon arrival at Fort Slocum, Hayes transferred patient care to the facility's medical personnel. The larger medical facility possessed enhanced diagnostic equipment, surgical capabilities, and specialist physicians not available at the forward medical station. Hayes provided comprehensive briefings on each patient's condition and treatment history to ensure continuity of care. Patient 7 was immediately transferred to the facility's emergency treatment area. Hayes's final notes indicated stable but critical condition, with ongoing concerns regarding potential organ damage from prolonged malnutrition and dehydration. The specialized medical personnel at Fort Slocum initiated advanced treatment procedures unavailable at the forward medical station. Hayes returned to the medical station at 1730 hours. The remaining patients had received basic medical treatment and showed signs of gradual improvement with proper nutrition and medical care. Hayes noted that several patients had begun communicating more effectively with nursing personnel, providing additional information about their medical histories and current symptoms. The evening shift brought new challenges as additional transport vehicles arrived, with more displaced civilians requiring medical assistance. Hayes documented that the medical station had treated 37 patients during the single day, exceeding normal capacity by approximately 60%. The increased patient load created logistical challenges regarding supply allocation, staffing assignments, and facility space management. Lieutenant Colonel Morrison conducted an evening briefing regarding the day's medical operations. The unusually high number of Japanese civilian patients had strained facility resources and required modifications to standard operating procedures. Morrison noted that similar situations might become more frequent as military operations continued and civilian populations sought assistance from allied medical facilities. Hayes completed her daily medical reports at 2100 hours. The official documentation process required detailed patient information, treatment protocols, and supply utilization records for submission to higher command levels. Hayes included recommendations for enhanced interpreter services and expanded medical supplies to accommodate increasing civilian medical needs. The medical station's communication equipment received an update regarding patient 7's condition at Fort Slocum. The patient had responded positively to advanced medical treatment and achieved stable condition by late evening. Medical personnel at Fort Slocum reported that patient 7 had provided additional information about her background, including previous medical training that explained her apparent knowledge of medical terminology. Hayes learned that patient 7 had worked as a medical assistant in a Manila hospital before the current military operations. Her medical knowledge had enabled her to provide basic care for the group of displaced women during their 2-week journey seeking Allied medical assistance. Patient 7's notebook contained detailed observations about the medical conditions affecting her companions, including dosage calculations for medications they had obtained from abandoned medical facilities. The revelation of patient 7's medical background created new considerations for military intelligence personnel. Japanese medical personnel possessed potential knowledge regarding medical facilities, supply networks, and civilian population health conditions in Japanese-controlled areas. Standard intelligence protocols required comprehensive debriefing of medical professionals who had operated in enemy-controlled territory. Hayes received instructions to prepare detailed reports regarding her interactions with patient 7 and any information obtained during medical treatment. Military intelligence personnel scheduled interviews with Hayes to gather information potentially relevant to ongoing military operations. The intelligence process would require Hayes to recall specific conversations, observations, and medical findings from her brief contact with patient 7. The following morning brought news that patient 7 had requested to speak with Hayes specifically. Fort Slocum's medical personnel reported that patient 7 had expressed gratitude for the medical treatment received and had indicated possession of information potentially valuable to Allied medical operations. The request created additional security considerations requiring approval from multiple command levels. Hayes received authorization to return to Fort Slocum for a supervised meeting with patient 7. The meeting would occur under observation by intelligence personnel and would follow specific protocols regarding information gathering and security procedures. Hayes prepared questions related to medical conditions affecting displaced civilian populations and potential health hazards in liberated areas. The meeting between Hayes and patient 7 occurred on February 25, 1945, in a secured area of Fort Slocum's medical facility. Patient 7, whose condition had stabilized significantly, identified herself as Sakura Tanaka, a trained medical technician who had worked at Manila General Hospital until January 1945. Tanaka possessed detailed knowledge regarding medical conditions affecting civilian populations in Japanese-controlled areas. Tanaka informed Hayes that the group of displaced women had included several individuals with specialized skills potentially valuable to Allied operations. Among the patients treated at the medical station were a former chemistry teacher, a telephone operator, and 2 women who had worked in administrative positions at government facilities. Tanaka had organized the group's journey specifically to reach Allied medical facilities and offer their knowledge in exchange for medical assistance and protection. The intelligence implications of Tanaka's information extended beyond immediate medical concerns. The specialized knowledge possessed by the displaced women could provide insights into Japanese administrative procedures, communication systems, and civilian infrastructure conditions. Military intelligence personnel requested expanded interviews with all members of the group to assess the potential value of their information. Hayes participated in the expanded intelligence gathering process while maintaining her primary medical responsibilities. The dual role created ethical challenges regarding the confidentiality of medical information and the military's intelligence requirements. Hayes consulted with Lieutenant Colonel Morrison regarding the appropriate boundaries between medical care and intelligence cooperation. The intelligence interviews revealed that Tanaka's group possessed comprehensive knowledge regarding medical supply networks, hospital operations, and public health conditions in Japanese-controlled Manila. Tanaka had maintained detailed records of medical shortages, disease outbreaks, and treatment protocols used by Japanese medical personnel. Her information could significantly enhance Allied understanding of civilian conditions in areas yet to be liberated. Military command authorized enhanced protection and support for Tanaka's group in recognition of their cooperation and potential intelligence value. The women received priority access to medical care, improved housing arrangements, and security protection unavailable to typical civilian refugees. Hayes noted that the improved treatment created ethical questions regarding equitable distribution of medical resources among civilian populations. Tanaka requested permission to assist with medical operations at Allied facilities, offering her technical knowledge and language skills to improve treatment of displaced Japanese civilians. Her proposal included training Allied medical personnel in communication techniques and cultural considerations relevant to treating Japanese patients. Military Medical Command evaluated the proposal's security implications and potential operational benefits. Hayes supported Tanaka's proposal based on the observed medical benefits and improved patient cooperation when cultural considerations were incorporated into treatment protocols. The language barrier had created significant challenges in providing effective medical care, and Tanaka's assistance could substantially improve treatment outcomes for displaced civilian populations. The approval process for Tanaka's medical assistance required evaluation by multiple command levels, including intelligence personnel, medical command, and operational security officials. Each level assessed different aspects of the proposal, creating a complex approval process that required several days to complete. Hayes documented her frustration with administrative delays that potentially impacted medical care quality. On March 2, 1945, Military Command approved Tanaka's limited participation in medical operations under strict security protocols. Tanaka would provide translation services and cultural guidance for medical personnel treating Japanese civilians, while maintaining restricted access to sensitive Allied medical facilities and information. Hayes received assignment as Tanaka's primary supervisory contact for medical activities. The collaboration between Hayes and Tanaka proved immediately beneficial for medical operations. Patient cooperation improved significantly when cultural considerations were incorporated into treatment approaches, and medical histories became more accurate with proper translation services. Hayes documented improved treatment outcomes and reduced patient anxiety when Japanese cultural practices were respected during medical procedures. Tanaka's medical knowledge also provided valuable insights into traditional Japanese medical practices and herbal treatments used by displaced civilians. Many patients had attempted self-treatment using traditional methods that sometimes conflicted with Allied medical protocols. Understanding these traditional approaches enabled medical personnel to provide more effective treatment while respecting cultural preferences. The success of the Hayes-Tanaka collaboration attracted attention from higher command levels, seeking to expand similar programs to other medical facilities. Military Medical Command requested detailed reports on the collaboration's effectiveness and recommendations for implementing similar programs at additional facilities throughout the Philippines. Hayes prepared comprehensive documentation supporting expanded cultural integration in medical treatment protocols. However, the collaboration also created unexpected challenges. Some Allied medical personnel expressed concerns about security risks associated with allowing former enemy civilians access to medical facilities and information. Others questioned the ethics of providing enhanced medical care to Japanese civilians, while Allied wounded sometimes experienced resource shortages. Hayes found herself defending the program's medical benefits while acknowledging legitimate security concerns. Intelligence reports indicated that Japanese military commanders had become aware of the medical collaboration program and were potentially using it for intelligence-gathering purposes. Security personnel identified several instances where Japanese civilians sought medical assistance while gathering information about Allied medical capabilities and procedures. The discovery created new security protocols that restricted Tanaka's access to certain areas and information. Hayes received instructions to monitor Tanaka for signs of intelligence-gathering activities while maintaining the medical collaboration. The dual responsibility created significant stress as Hayes attempted to balance security concerns with medical effectiveness and personal trust developed through professional collaboration. Hayes noted in her reports the psychological strain of conducting medical operations under constant security surveillance. The security concerns intensified when military intelligence discovered that Tanaka's notebook contained detailed observations about Allied medical procedures, personnel assignments, and facility layouts. While Tanaka claimed the observations were made for medical learning purposes, intelligence personnel identified potential military value in the information. Hayes faced questioning regarding her role in potentially enabling intelligence-gathering activities. The investigation process created substantial disruption to medical operations as security personnel reviewed all interactions between Allied medical staff and Japanese civilians. Hayes underwent extensive debriefing regarding her professional relationship with Tanaka and any information potentially compromised during their collaboration. The investigation lasted 6 days and significantly impacted morale among medical personnel. On March 10, 1945, Military Command suspended the medical collaboration program pending completion of the security investigation. Tanaka was transferred to a secure facility for comprehensive intelligence debriefing, while Hayes returned to standard medical duties without access to cultural consultation services. The suspension created immediate challenges in treating Japanese civilian patients who had benefited from the cultural considerations incorporated into treatment protocols. Hayes documented declining treatment effectiveness and increased patient anxiety following termination of the cultural consultation program. Medical personnel struggled to communicate effectively with Japanese patients, leading to incomplete medical histories and reduced treatment compliance. Several patients refused medical treatment entirely, preferring to leave Allied medical facilities rather than accept care without cultural considerations. The security investigation concluded on March 16, 1945, with findings that Tanaka had engaged in systematic intelligence gathering, but had also provided genuine medical assistance that improved treatment outcomes. Military Command determined that the program's medical benefits outweighed security risks when proper protocols were implemented. Hayes received authorization to resume limited collaboration under enhanced security supervision. The resumed collaboration operated under strict limitations that reduced its effectiveness compared to the initial program. Tanaka's access was restricted to specific areas and times. Security personnel monitored all interactions, and detailed documentation was required for every conversation. Hayes noted that the security restrictions created artificial barriers that reduced the natural patient trust essential for effective medical treatment. Despite the limitations, Hayes and Tanaka continued their medical collaboration with measurable improvements in patient outcomes. The program served 37 Japanese civilian patients during the month of March, with documented improvements in treatment compliance, accurate medical histories, and reduced patient anxiety compared to periods without cultural consultation services. Military Medical Command noted these improvements in evaluating the program's continuation. On March 28, 1945, Tanaka requested a private meeting with Hayes to discuss concerns about the medical treatment of several patients in the group. Tanaka had observed signs of declining health among some women that she believed required immediate intervention beyond the standard care being provided. Hayes arranged the meeting through proper security channels, including supervision by military personnel. During the supervised meeting, Tanaka explained that traditional Japanese dietary practices and medical beliefs were creating barriers to recovery among several patients. The women were refusing certain medications and foods based on traditional beliefs about medical treatment, while being too polite or fearful to openly communicate these concerns to allied medical personnel. Tanaka requested permission to address these cultural barriers directly with the affected patients. Hayes recognized the medical validity of Tanaka's concerns based on her observations of patient behavior and treatment compliance. Several patients had shown slower recovery rates despite adequate medical treatment, suggesting that cultural factors might be impacting treatment effectiveness. Hayes requested authorization to implement modified treatment protocols that incorporated traditional Japanese medical practices when medically appropriate. The request required approval from Medical Command, intelligence personnel, and cultural affairs officers attached to military government operations. Each group evaluated different aspects of the proposal, creating another complex approval process. Hayes documented her frustration with administrative procedures that delayed medical interventions for cultural considerations that directly impacted patient health outcomes. Military Command approved modified treatment protocols on April 2, 1945. With specific guidelines regarding acceptable cultural accommodations and required security oversight. Hayes received authorization to work with Tanaka in developing culturally appropriate treatment approaches that maintained medical effectiveness while respecting Japanese traditional practices. The approval included requirements for detailed documentation and regular security reviews. The implementation of culturally modified treatment protocols produced immediate improvements in patient cooperation and recovery rates. Patients who had been refusing medications accepted treatment when cultural explanations were provided, and dietary modifications improved nutritional compliance among patients with traditional food preferences. Hayes documented these improvements as evidence supporting expanded cultural consideration in medical treatment. However, the program's success also attracted unwanted attention from various military and civilian officials seeking to utilize Tanaka's cultural knowledge for non-medical purposes. Requests arrived from psychological warfare units, civil affairs officers, and intelligence personnel seeking access to Tanaka for cultural consultation beyond medical applications. Hayes found herself defending the medical program against attempts to exploit it for other military purposes. The competing demands created ethical dilemmas regarding the appropriate use of cultural knowledge gained through medical collaboration. Hayes argued that expanding Tanaka's role beyond medical consultation would violate the trust essential for effective patient care and potentially compromise the medical mission for military intelligence purposes. Military Command faced decisions regarding priority allocation of Tanaka's cultural expertise. On April 8, 1945, Military Command determined that Tanaka's cultural knowledge was too valuable for military operations to restrict her role exclusively to medical consultation. Hayes received orders to cooperate with expanded utilization of Tanaka's expertise while maintaining medical program effectiveness. The decision created conflicts between medical ethics and military requirements that Hayes struggled to resolve professionally. The expanded utilization required Tanaka to provide cultural consultation for military government operations, psychological warfare activities, and intelligence gathering operations beyond medical applications. Hayes noted that the additional responsibilities reduced Tanaka's availability for medical consultation and created potential conflicts of interest that could impact patient trust and treatment effectiveness. Hayes requested clarification regarding her professional responsibilities when medical ethics conflicted with military orders involving Tanaka's expanded role. The request produced meetings with military legal personnel, medical ethics advisors, and command officers seeking to establish clear guidelines. Hayes documented that the process revealed significant disagreements among military officials regarding the appropriate balance between medical ethics and military effectiveness. The ethical conflicts intensified when Hayes learned that information obtained through medical consultation was being used for military intelligence purposes without patient knowledge or consent. Tanaka had provided cultural insights about patient backgrounds and family situations that were subsequently used by intelligence personnel for operations unrelated to medical care. Hayes protested this use of medical information for non-medical purposes. Military command responded that wartime conditions required flexibility in information utilization and that Hayes's primary responsibility was supporting military objectives rather than maintaining peacetime medical ethics standards. The response created a fundamental conflict between Hayes's professional medical training and her military duties. Hayes requested transfer to medical assignments without cultural consultation responsibilities. The transfer request was denied due to the program's documented medical effectiveness and Hayes's specialized experience with cross-cultural medical treatment. Military command determined that Hayes's skills were too valuable for the current assignment to permit transfer to other medical duties. Hayes received orders to continue medical operations while accommodating military requirements for Tanaka's expanded utilization. Hayes continued medical operations under increasingly difficult ethical conditions while documenting her concerns about the compromise of medical ethics for military purposes. Her reports noted declining patient trust as rumors spread among Japanese civilian populations about the use of medical information for intelligence gathering. Several patients requested transfer to other medical facilities or refused treatment entirely rather than risk intelligence exploitation. On April 15, 1945, the Medical Collaboration Program received a significant test when a large group of Japanese civilians arrived at the medical station in critical condition. The group included 12 women and 3 children who had been traveling for 3 weeks seeking Allied medical assistance. Hayes faced immediate decisions regarding treatment priorities and cultural consultation requirements under emergency medical conditions. Tanaka was attending a military intelligence briefing when the emergency patients arrived, creating immediate challenges for Hayes in providing culturally appropriate medical care. The patients exhibited extreme malnutrition, dehydration, and signs of disease exposure that required immediate intervention. Hayes initiated emergency treatment protocols, while requesting expedited access to Tanaka for cultural consultation. The emergency treatment revealed the practical importance of cultural considerations in medical care when Hayes encountered strong patient resistance to certain medical procedures. Several patients refused intravenous treatments based on traditional beliefs, while others resisted physical examinations by male medical personnel. Hayes struggled to provide effective emergency care while respecting cultural preferences that conflicted with medical protocols. Military command authorized Tanaka's immediate return from the intelligence briefing to assist with the medical emergency. However, The delay had already created treatment complications, as several patients' conditions had deteriorated, while Hayes attempted to provide care without cultural consultation. Tanaka's arrival enabled more effective treatment, but valuable time had been lost due to competing military priorities. The medical emergency illustrated the practical conflicts between military utilization of Tanaka's expertise and medical requirements for consistent cultural consultation. Hayes documented that emergency medical situations required immediate access to cultural consultation rather than scheduled availability around other military assignments. She requested priority allocation of Tanaka's time for medical consultation. Military Command reviewed Hayes's request in the context of competing military requirements for Tanaka's cultural expertise. Intelligence operations, psychological warfare activities, and military government functions all claimed essential need for Tanaka's knowledge. Hayes argued that medical emergencies created life-threatening situations that should receive priority over other military activities that could be rescheduled. The priority allocation discussion continued for several days, while Hayes continued providing medical care under challenging cultural conditions. Additional Japanese civilian patients arrived, requiring culturally appropriate treatment, while Tanaka remained assigned to non-medical military activities. Hayes documented declining treatment effectiveness and patient cooperation due to cultural consultation limitations. On April 20, 1945, Military Command established a compromise allocation system that provided Hayes with guaranteed access to Tanaka for specified periods while maintaining her availability for other military assignments. The system included emergency protocols for medical situations requiring immediate cultural consultation. Hayes noted that the formal allocation process acknowledged the medical importance of cultural considerations. The allocation system improved medical operations but did not resolve the underlying ethical conflicts regarding the use of medical information for intelligence purposes. Hayes continued documenting patient concerns about confidentiality and treatment trust, while providing the most effective medical care possible under wartime constraints. Her reports reflected ongoing tension between medical ethics and military requirements. Tanaka's dual role continued creating challenges, as patients became aware that cultural information shared during medical treatment might be used for military intelligence purposes. Some patients modified their communications with medical personnel to avoid sharing information potentially valuable for intelligence gathering. Hayes noted that these modified communications reduced the accuracy of medical histories and potentially impacted treatment effectiveness. The medical program achieved documented improvements in treatment outcomes despite the ethical challenges surrounding Tanaka's expanded military role. Hayes's reports indicated successful treatment of 137 Japanese civilian patients during the 2-month collaboration period. Medical statistics showed reduced complications, improved treatment compliance, and shorter recovery times compared to periods without cultural consultation. Military Medical Command used Hayes's statistics to support expansion of similar cultural consultation programs at other medical facilities throughout the Philippines. Plans included recruitment of additional Japanese-American interpreters and development of standardized protocols for culturally appropriate medical treatment. Hayes participated in planning meetings while maintaining her operational responsibilities at the medical station. The expansion planning revealed that Hayes's experience represented a successful model for cross-cultural medical treatment under military conditions. Her documentation provided guidance for other medical personnel facing similar challenges in treating civilian populations with different cultural backgrounds. Military Medical Command requested detailed protocols based on Hayes's practical experience. Hayes prepared comprehensive training materials describing effective approaches for culturally sensitive medical treatment based on her collaboration with Tanaka. The materials included communication techniques, cultural consideration protocols, and methods for balancing medical ethics with military requirements. Hayes noted that her documentation might benefit other medical personnel facing similar ethical challenges. On April 28, 1945, Hayes received orders for reassignment to a larger medical facility in Manila, where she would implement expanded cultural consultation programs. The reassignment recognized her specialized expertise while providing opportunities for broader application of her experience. Hayes would supervise multiple cultural consultants while maintaining direct medical care responsibilities. The reassignment required Hayes to train replacement medical personnel for the station where she had developed the original collaboration with Tanaka. Hayes prepared detailed briefings describing the program's medical benefits, operational challenges, and ethical considerations. She emphasized the importance of maintaining patient trust while balancing cultural sensitivity with medical effectiveness. Tanaka received assignment to continue cultural consultation at Hayes's original medical station under supervision of the replacement medical personnel. The continued assignment reflected military command's recognition of the program's medical value despite ongoing security concerns. Tanaka would maintain her dual role, providing medical consultation and supporting other military operations requiring cultural expertise. Hayes's final report on the cultural consultation program documented both medical successes and ethical challenges encountered during the collaboration. Her recommendations included suggestions for improved security protocols, enhanced training for medical personnel, and clearer guidelines for balancing medical ethics with military requirements. Hayes noted that the program's medical benefits justified continued development despite operational complications. The collaboration between Hayes and Tanaka concluded on April 30, 1945, after 2 months of innovative cross-cultural medical treatment. Hayes's statistics indicated significant improvements in treatment outcomes for Japanese civilian patients while maintaining military security requirements. The program provided a model for culturally sensitive medical care that influenced Allied medical operations throughout the Pacific Theater. Hayes departed for her new assignment with recognition from Military Medical Command for developing effective protocols for cross-cultural medical treatment under combat conditions. Her experience provided practical guidance for other medical personnel facing similar challenges while establishing standards for balancing medical ethics with military requirements. The program's success influenced policy development for post-war medical operations. Years later, Hayes's documentation of the Cultural Consultation Program became part of military medical records, studying the effectiveness of cross-cultural treatment approaches. Her detailed reports provided insights into the practical challenges of maintaining medical ethics while meeting military objectives during wartime operations. The documentation contributed to development of improved protocols for military medical personnel serving in cross-cultural environments. The medical station, where Hayes developed her collaboration with Tanaka, continued operating with cultural consultation services throughout the remainder of the war. Subsequent medical personnel built upon Hayes's protocols to provide effective treatment for displaced civilian populations while maintaining military security requirements. The station treated over 800 Japanese civilian patients using culturally appropriate treatment approaches developed from Hayes's experience. Tanaka continued providing cultural consultation for Allied medical operations until the conclusion of military operations in the Philippines. Her dual role supporting both medical care and military intelligence demonstrated the complex relationships between humanitarian assistance and military objectives during wartime. Tanaka's contributions to medical care saved numerous lives while providing valuable cultural insights for military operations. The medical emergency that brought Hayes and Tanaka together on February 23, 1945, illustrated the importance of cultural understanding in effective medical treatment. Their collaboration demonstrated that cultural sensitivity could significantly improve medical outcomes, even under challenging wartime conditions. The program they developed influenced Allied medical policies throughout the Pacific Theater and provided models for post-war humanitarian medical operations. Military records indicate that Hayes's cultural consultation program achieved treatment success rates approximately 25% higher than standard medical protocols for Japanese civilian patients. The improved outcomes resulted from enhanced patient cooperation, more accurate medical histories, and reduced anxiety among patients receiving culturally appropriate care. These statistics supported expansion of similar programs throughout Allied medical operations. The ethical challenges Hayes faced regarding the balance between medical ethics and military requirements reflected broader questions about humanitarian assistance during military operations. Her experience provided practical insights into maintaining professional medical standards while supporting military objectives. Hayes' documentation contributed to development of clearer guidelines for medical personnel serving in similar circumstances. The program's documentation became part of military medical training materials used to prepare personnel for cross-cultural medical assignments. Hayes's practical experience provided realistic examples of the challenges medical personnel might encounter when treating patients from different cultural backgrounds during military operations. The training materials helped subsequent medical personnel understand both the benefits and complications of culturally sensitive medical care. Intelligence reports from the period indicate that the Cultural Consultation Program significantly improved Allied relationships with Japanese civilian populations in liberated areas. The respectful treatment of Japanese patients created positive impressions that facilitated military government operations and reduced resistance to Allied occupation. Hayes's medical approach had strategic benefits beyond immediate patient care. The collaboration between Hayes and Tanaka represented successful cooperation between former enemies based on shared humanitarian objectives. Their professional relationship demonstrated that medical ethics could transcend political and military conflicts when properly managed. The program provided a model for post-war cooperation based on mutual respect and professional collaboration. Post-war interviews with patients treated during the Cultural Consultation Program indicated high levels of satisfaction with the medical care received, despite initial fears about treatment by Allied personnel. Patients credited the cultural sensitivity demonstrated by Hayes and Tanaka with reducing anxiety and improving their willingness to accept necessary medical treatment. Many patients reported that the respectful treatment influenced their positive attitudes toward Allied occupation policies. Hayes's experience influenced her post-war medical career as she continued working in cross-cultural medical environments. Her expertise in culturally sensitive medical treatment led to assignments with international medical organizations providing humanitarian assistance in various countries. Hayes applied lessons learned from her wartime collaboration with Tanaka throughout her subsequent medical career. Military Medical Command incorporated Hayes's protocols into standard procedures for treating civilian populations during military operations. The guidelines she developed became part of training curricula for military medical personnel, preparing for deployment in cross-cultural environments. Hayes's practical experience provided realistic guidance for maintaining medical effectiveness while respecting cultural differences. The success of the Cultural Consultation Program contributed to broader Allied policies regarding treatment of Japanese civilian populations during the occupation period. The respectful approach developed by Hayes and Tanaka influenced military government directives that emphasized humanitarian assistance and cultural sensitivity in post-war administration. Their collaboration provided practical evidence, supporting policies based on cooperation rather than punishment. Tanaka's post-war career included continued work with international medical organizations providing cultural consultation for cross-cultural medical programs. Her experience collaborating with Allied medical personnel during the war demonstrated the value of cultural understanding in effective medical treatment. Tanaka's expertise contributed to development of improved protocols for international medical assistance programs. The medical station where Hayes and Tanaka developed their collaboration was converted to a civilian hospital following the conclusion of military operations. The facility continued serving Japanese and Filipino patients using culturally appropriate treatment approaches developed during the wartime collaboration. The hospital became a model for post-war medical facilities, emphasizing cross-cultural understanding and patient respect. Documentation of the Hayes-Tanaka collaboration contributed to academic studies of cross-cultural medical treatment and humanitarian assistance during military operations. Their experience provided practical examples of successful cooperation between former enemies based on shared medical objectives. Academic researchers used their collaboration as a case study for effective cross-cultural medical programs. The ethical challenges Hayes documented regarding the balance between medical ethics and military requirements became part of military medical ethics training programs. Her experience provided realistic examples of the difficult decisions medical personnel might face when humanitarian objectives conflicted with military requirements. Hayes's documentation helped develop clearer guidelines for medical personnel facing similar ethical dilemmas. The cultural consultation program's influence extended beyond medical treatment to broader Allied policies regarding cross-cultural cooperation during military operations. The success Hayes and Tanaka achieved demonstrated that respectful collaboration could achieve better results than coercive approaches. Their program influenced military policies emphasizing cooperation and mutual respect in cross-cultural environments. Years after the war, Hayes and Tanaka maintained correspondence, reflecting their shared commitment to cross-cultural medical cooperation. Their continued friendship demonstrated that professional relationships based on humanitarian objectives could transcend political and military conflicts. Their post-war communication contributed to development of international medical cooperation programs. The medical emergency that initiated Hayes's collaboration with Tanaka on February 23, 1945, became part of military medical history as an example of innovative problem-solving under challenging conditions. Their program demonstrated that cultural sensitivity could significantly improve medical outcomes even during active military operations. The collaboration influenced Allied medical policies throughout the Pacific Theater. Military medical records indicate that the cultural consultation program Hayes developed with Tanaka served as a model for similar programs in other theaters of military operations. The success they achieved in treating Japanese civilian patients influenced policies for treating civilian populations in European and other Pacific locations. Their collaboration provided practical guidance for medical personnel serving in diverse cultural environments. The comprehensive documentation Hayes maintained regarding the cultural consultation program contributed to post-war development of international medical assistance protocols. Her detailed reports provided realistic examples of the challenges and benefits of culturally sensitive medical treatment. International medical organizations used Hayes's experience to develop improved guidelines for cross-cultural medical programs. The success of Hayes's collaboration with Tanaka demonstrated that effective medical treatment required understanding of cultural factors beyond purely medical considerations. Their program showed that patient cooperation and treatment compliance improved significantly when cultural preferences were respected and accommodated. This insight influenced development of patient-centered medical care approaches in various cultural contexts. The medical station, where Hayes developed her innovative collaboration with Tanaka, treated over 2,000 patients during its operational period, with documented improvement in treatment outcomes following implementation of cultural consultation protocols. The facility became a training center for medical personnel preparing for assignments requiring cross-cultural medical skills. Hayes's experience provided the foundation for training programs used throughout Allied medical operations. The legacy of Hayes's collaboration with Tanaka extended far beyond the immediate wartime context. Military medical archives from 1945 document that their cultural consultation program became the template for Allied medical operations throughout Southeast Asia. The program's emphasis on respectful treatment of civilian populations influenced broader military policies regarding humanitarian assistance during combat operations. Intelligence reports declassified decades later revealed that the program's success significantly improved Allied intelligence gathering capabilities. Japanese civilians who received respectful medical treatment became valuable sources of information about conditions in Japanese-controlled territories. The trust established through culturally sensitive medical care proved more effective than coercive interrogation methods in obtaining useful intelligence. Hayes's documentation of the ethical challenges she faced became required reading for military medical personnel preparing for deployment in cross-cultural environments. Her honest assessment of the conflicts between medical ethics and military requirements provided realistic guidance for healthcare providers serving in similar circumstances. Military medical training programs incorporated Hayes's experience to prepare personnel for the complex decisions they might encounter. The medical techniques developed during the Hayes-Tanaka collaboration influenced post-war international medical assistance programs. Organizations providing humanitarian aid in cross-cultural environments adopted protocols based on their experience. The emphasis on cultural sensitivity and patient respect became standard practice for international medical missions operating in diverse cultural contexts. Tanaka's role in the program demonstrated the potential for former enemies to collaborate effectively on humanitarian objectives. Her willingness to provide medical assistance despite ongoing military operations illustrated how shared professional values could transcend political conflicts. Tanaka's experience became an example of successful post-conflict cooperation based on mutual respect and common goals. The medical station's records indicate that patient satisfaction rates increased dramatically following implementation of the cultural consultation program. Surveys conducted among Japanese civilian patients showed high levels of appreciation for the respectful treatment they received. Many patients credited the cultural sensitivity demonstrated by Hayes and Tanaka with reducing their fear and improving their willingness to seek necessary medical care. Military command evaluations of the program noted significant improvements in operational effectiveness when cultural considerations were incorporated into medical treatment protocols. The enhanced patient cooperation reduced treatment times, improved diagnostic accuracy, and increased success rates for medical interventions. These practical benefits supported continued investment in cross-cultural medical training for military personnel. Hayes' career following the war included assignments with international medical organizations where she applied lessons learned from her collaboration with Tanaka. Her expertise in culturally sensitive medical treatment led to leadership positions in humanitarian medical programs operating in various countries. Hayes continued advocating for patient-centered care that respected cultural differences throughout her professional career. The influence of the Hayes-Tanaka collaboration extended to academic medical education, where their experience became a case study for cross-cultural medical treatment. Medical schools incorporated their story into curricula addressing cultural competency in healthcare delivery. Students studying international medicine learned from Hayes's practical experience about the importance of cultural understanding in effective medical treatment. Post-war correspondence between Hayes and Tanaka revealed their continued commitment to cross-cultural medical cooperation. Their friendship demonstrated that professional relationships based on humanitarian objectives could survive political conflicts and continue contributing to improved medical care. Their ongoing collaboration influenced development of international medical exchange programs. The medical emergency of February 23, 1945, that brought Hayes and Tanaka together ultimately saved hundreds of lives through the innovative treatment protocols they developed. Their collaboration proved that cultural sensitivity could significantly improve medical outcomes even under the most challenging wartime conditions. The program they created influenced Allied medical policies throughout the Pacific Theater and provided lasting contributions to cross-cultural medical care. Military historians studying the Pacific Campaign noted that the Cultural Consultation Program represented a successful example of humanitarian cooperation during military operations. The respectful treatment of Japanese civilians contributed to positive relationships that facilitated post-war reconstruction and reconciliation. Hayes and Tanaka's collaboration demonstrated that shared humanitarian values could transcend military conflicts. The documentation Hayes maintained regarding the Cultural Consultation Program was preserved in military medical archives and later contributed to academic research on cross-cultural medical treatment. Her detailed reports provided insights into the practical challenges of maintaining medical ethics while meeting military objectives. Researchers studying humanitarian assistance during military operations used Hayes's experience as a primary source. The success of the Hayes-Tanaka collaboration influenced Allied occupation policies in Japan, where cultural sensitivity became a priority for military government operations. The positive results achieved through respectful treatment of Japanese civilians supported policies emphasizing cooperation rather than punishment. Their program provided practical evidence that cultural understanding could improve both humanitarian and strategic outcomes. Decades later, veterans of the Pacific Campaign recalled the Cultural Consultation Program as an example of successful cross-cultural cooperation during wartime. Interviews with former military medical personnel indicated widespread recognition of the program's effectiveness and influence on their approach to treating diverse patient populations. Hayes's innovation was remembered as a significant contribution to military medical care. The medical station where Hayes developed her collaboration with Tanaka was designated as a historical site, recognizing the innovative approach to cross-cultural medical treatment developed there. The facility's contribution to improved medical care and cross-cultural understanding was commemorated as part of the broader history of humanitarian assistance during military operations. The comprehensive records of the Hayes-Tanaka collaboration provided valuable data for researchers studying the effectiveness of culturally sensitive medical treatment. Statistical analysis of treatment outcomes demonstrated significant improvements when cultural considerations were incorporated into medical protocols. These findings supported broader adoption of cross-cultural medical training for healthcare providers. The ethical framework Hayes developed for balancing medical ethics with military requirements became part of military medical policy guidelines. Her practical experience provided realistic guidance for healthcare providers facing similar moral dilemmas during military operations. Hayes's contribution to military medical ethics continued influencing policy development long after the war's conclusion. The cultural consultation program's influence on international medical cooperation extended well beyond its wartime origins. The protocols Hayes and Tanaka developed became models for humanitarian medical assistance in various international contexts. Their collaboration demonstrated that cultural understanding could significantly improve the effectiveness of medical aid programs, regardless of political circumstances. On February 23, 2005, exactly 60 years after the medical emergency that brought them together, surviving members of Tanaka's original group gathered to commemorate the lives saved through the cultural consultation program. Their testimonials confirmed the lasting impact of the respectful medical treatment they received and its influence on their positive attitudes toward international cooperation. The legacy of Hayes's collaboration with Tanaka continues influencing modern medical practice through training programs emphasizing cultural competency in healthcare delivery. Medical professionals serving in diverse cultural environments study their experience as an example of effective cross-cultural medical treatment. Their innovative approach to respecting cultural differences while maintaining medical effectiveness remains relevant for contemporary healthcare providers. Military medical records from 1945 document that the cultural consultation program Hayes developed with Tanaka treated over 800 Japanese civilian patients with documented improvement in treatment outcomes. The program's success demonstrated that cultural sensitivity could significantly enhance medical effectiveness even under challenging wartime conditions. Their collaboration provided lasting contributions to cross-cultural medical care that continue influencing healthcare delivery decades later. The story of Hayes and Tanaka's collaboration serves as a reminder that humanitarian cooperation can transcend political and military conflicts when based on shared professional values and respect for human dignity. Their program demonstrated that effective medical treatment requires understanding of cultural factors beyond purely medical considerations. The legacy of their innovation continues inspiring healthcare providers serving diverse populations around the world.